Hi to everyone. Hi everyone, and thank you, Natalie, for organizing this symposium. I'm Maria Breda, a PhD student from Sapienza University and a neuropsychiatric. And I will show you our work about sleep and temperament in infancy. We use the Nanit camera to understand the relationship between these two. Okay, as we know, both temperament and sleep are influenced by several factors. According to Rothbard theory, parental culture and style interact with infant factors as genetic and neurobiological factors to influence the expression and development of temperament traits. And similarly, according to the transactional model of Sade, sleep is ecologically based and determined by the complex relation between individual constitutional factors of infants and the environmental factors, where we can find the parenting factors, so the parent-child interactive context. As we know, there are very different infants. We can have easy temperament infants, so infants that are easy approachable and that have a tendency to extraversion, a greater expression of positive emotional states. And on the other hand, we can have a difficult temperament infant who tend to be very irritable, tend to manifest fear, anger, sadness, discomfort. And we know from the literature that children with difficult temperament tend to have worse sleep patterns. In particular, we know that children with difficult temperaments more frequently have sleep problems, and that children with low sensory threshold and poor adaptive skills have more problem maintaining sleep. But these findings came from studies that used the subjective sleep metrics or that had very small samples. So our aim was to understand the relation between sleep and temperament in infancy, basing on objective sleep metrics. So a cross-sectional study on healthy infants in their ecological environment. And this is very important because we also wanted to know how the ecological environment, and in particular parental behavior at bedtime and during the night, could influence the relationship between child temperament and sleep. So we used the Nanit camera to assess infant sleep. We recorded 1 week of sleep, and we asked the parents to fill some questionnaires: the Edinburgh postnatal depression scale for parent depression, the brief infant sleep questionnaire for bedtime routines, and the infant behavior questionnaire for infant temperament. This scale has 3 subscales: negative emotionality, positive affectivity, and orienting regulatory capacity. We had a sample of 600 infants and 4,000 nights recorded. 52% of our infants were female. The mean age was 10 months, and 27% of our infants followed asleep with breastfeeding or bottle feeding, and 32% of them followed asleep while held or rocked. But what about the relation between temperament and sleep? The only subscale that significantly correlated with sleep metrics was the negative emotionality. In particular, higher negative emotionality was linked with shorter nightly sleep duration, lower sleep efficiency, greater waking time during the night, delay in bedtime, greater number of nocturnal awakenings, and of caregiver visits. So these results were in line with the present findings, supporting a correlation between negative affectivity and worse sleep patterns. But what about bedtime routines? We found that active physical comforting, such as holding and rocking, and maternal breastfeeding or bottle feeding at bedtime, were both associated with difficult temperament, so higher scores in negative affectivity, and with worse sleep patterns, expressed by shorter night sleep duration, lower sleep efficiency, and more caregiver visits. But there was no significant difference in the number of night awakenings between children with active physical comforting and children with no active physical comforting and falling asleep on their own. These findings are in line with the prior studies and in line with the transactional model of sleep from Baisade et al. When we put all these metrics into a hierarchical regressional model, we find that bedtime interaction between parent and child explained the 20% of variance in night sleep duration. So it was the major factor explaining night sleep duration, more than temperament, that explained only the 3% of variation in night sleep duration. So in conclusion, what we can say, surely there is a complex and multidirectional relation among temperament, sleep quality, and parental involvement at bedtime. Surely we know that children with low sensory threshold, low adaptability, and high reactivity are more likely to have poorer sleep quality. But we know also that lower sleep quality can increase irritability and decrease the self-regulation capacity in infants. We know also that children with difficult temperaments might necessitate greater parental support in stabilizing their sleep-wake cycles. And on the other hand, the parental involvement at bedtime does not allow the child to experience his own capacity for self-regulation and predisposed to the persistency of sleep problems in these children. We know also that sleep problems often require parental intervention at bedtime and during the night. So it's a very complex model, and our study surely support a positive association among infant difficult temperament, active parental involvement during bedtime, and poor sleep quality, supporting present findings. But we can say that each parent-child dyad should find its own balance between the promotion of infants' autonomy and self-regulation and the active parent support at bedtime. We can say also that parent perception of infant temperament could have some influence of how parents manage infant sleep behaviors. In fact, in our study, parents actively involved in infants' bedtime tended to present more intervention in the night than parents not involved, although there was no difference in infants' night awakenings between the two. And this could be explained by a different predisposition of a different parental predisposition toward the infant sleep, where parents of difficult temperament infants tend to be more apprehensive and more likely to check on their infant sleep. This work was conducted by Maristella Lucchini, Natalie, and my professor Olivia Rubruni and me. And I really would like to thank you them for the great work and never-ending support. So thank you very much.
Thanks, Maria. Amazing. It's really fascinating to see those results come to light, and I'm really excited to see where this work continues to go. So we have a question in the Q&A that I would love to ask you. In this study, you've looked at average sleep metrics. Have you looked at the variability of these sleep metrics, and what are your hypotheses around those?
Oh, yes. Yes, the variable on sleep. This is an interesting question because we fought on the variability in night duration after having done all the statistics. But we think it's very important also with Maristella. We talk about that. And we think that we know from the literature that variability of sleep duration is important metrics that show bad sleep pattern. So I think it's an important metrics to consider, and I think in the next time we put it in the statistics.
Yes, I agree. I think that it will be really interesting to take a look at that. Okay, so thank you so much, Maria. That was amazing.